I'm speaking today with Dr Janet Hal, and Dr Janet is a clinical psychologist and has a broad range of interest, and one area of particular interest to her is that of children who might have been affected by the bushfire traumas. Jan, welcome. Thank you for coming in. What problems would you expect to arise with children affected by the bushfire?
Well, Ray, I mean, this is a great devastation for our community and on all levels, but for children, we're particularly worried about how they'll deal with the grief, the loss of everything perhaps in their world, and the fear. Fear about what has happened and fear that it might happen again.
How might these problems manifest themselves?
Well, children are quite transparent in how they are affected by grief and fear. And the sorts of things that they will show or indicate are things like babyish reversals, that they might bite their nails, wet the bed, have difficulty sleeping, not want to sleep alone. They'll be clingy, they may cry a lot. And then there are some kids who will become very aggressive. So it's not just the babyish fearful signs. You have to watch out for kids who start to have tantrums and start being very demanding. And they just need a cuddle sometimes to settle them down.
What then would be the signs that adults should be on the lookout for?
So the signs that adults should be looking out for is virtually any change in your child. If you had a quiet child before, and the child's starting to act out, well, that's a sign of something serious, and vice versa. You'll know if they're clingy and they're dependent, and if they're not talking, or even if they're talking too much sometimes. It is a natural thing that people will try to act as if everything's normal when something really bad happens. And children are sometimes modelling their adults who may be doing that.
Yeah.
And so, as adults, you need to be able to model that, it's not over with, that you are suffering and that it's okay to talk about it.
Thanks for that. In those circumstances, what advice would you give to people in dealing with affected children?
So, for the adults who have to deal with the children who are affected, I think you have to be able to re-establish routines as soon as possible. Now, I know that's not easy for those people who don't have a house anymore, but within whatever establishment that you're staying, get into a routine. Children love the stability and the security of knowing what to expect in their lives. The other thing is to reach out. I mean, the community is there. Perhaps your church, certainly your extended family. We've all been a little bit insulated, living in our little cocoons. So maybe, the one good thing that can come out of a big disaster like this is that we'll start to reach out to others again. And you also need to just keep reassuring the children that they are safe and that you will do everything that you can to protect them.
I'll give you a very good point. A really important question at the end for us all is, are there any support services where people can get help with these matters?
So, for support services, well, there's, first I think would be the teachers in the schools. Your teacher knows your child better than most anybody. And so, if you have any concerns or if you just want to find out how your child's reacting out there in the big world, go chat to the teacher. And the other thing, of course, is to go see a psychologist like me. Fortunately, Medicare now will cover all your expenses. You need to take the child to the GP and get what's called a mental health plan. And if you need to, ring around, but I'm sure I know that there are 500 psychologists who volunteered their services, and the Medicare plan should cover that too. So, go very local to your teacher. Your GP is a great resource, and get a referral to a psychologist. And talking about it early, not immediately in the first same month, but by about the third month is when people need to say, well, how am I faring? How do I make sense of all of this? How do I cope? Because the first 3 months is often just shock. But around about 3 months, you know, and grandparents should be encouraging their children to take their children to see somebody and help them debrief.
Well, thanks, Jan. That was great, and it was really kind of you to come in and talk with us today. I'm
My
sure our
pleasure.
seniors will really value it.
Thank you.